So today we are going to be talking about some movements in anatomical planes. And I chose to find pictures of them because I'm a visual learner myself, and I would think that pictures kind of reinforce what you're saying. And if people don't understand what you're saying, sometimes a picture says more than that, or it helps kind of show them what you're saying, or they understand it without really understanding. So the first one we're going to talk about is flexion and extension. And most of the time people remember that one because of like flexing your guns or showing your guns. People say that all the time. And when you're showing your guns, that's actually flexing. And that's when you're decreasing a joint angle in a sagittal plane. And the opposite of that would be extension. And that's when you're straightening a joint, and it generally is returning the body position to its normal position. The next one, or pair, is abduction and adduction, and that's away from the midline, which is abduction, and adduction is towards the midline. And I tend to like to think of things or draw them to real life scenarios. So most of the time when you're like putting on deodorant or something, you're abducting your arm. So that's the easiest way I feel like to remember it. You're away from the midline, and towards the midline is adduction, which I tend to think that's adding something, so it's towards the midline. The next pair is pronation and retraction. And this is anterior movement of a body part in the transverse plane, and retraction is the opposite, which is posterior. And the easiest way I think to remember that is like a push-up. So when you're going down, that's protraction, and then when you're coming back up, that's retraction. It's also like pushing a door open. Your shoulder protracts to open it, and then when it goes backwards to like when you're going through the door, that's retraction. Next one is circumduction, which sometimes people confuse with rotation. And circumduction is actually a 360 circle. So I did two different pictures because your head can't circumduct unless you're like from the Exorcist or something. Because most of the time your head can only rotate, which is like a left or right lateral or medial rotation. Whereas circumduction is a complete 360 circle, but keeping the joint fixed from moving. And I tend to think of that as like arm circles. I know everyone probably had to do arm circles at some point in gym class for a grade, and that's circumduction. And then I said rotation is generally lateral and medial, so and it's on a fixed axis, so you can't move 360. So your head would be one of the examples, or your leg can go in and out, which would also be another example. The next pair is pronation and supination. And supination is when your forearm turns the palm to face anteriorly or upwards. So your anatomical position is the forearm is supinated, the radius is parallel to the ulna, where it's upside down. Your palm is upside down with your bone sticking up. And how I like to think that is like turning a doorknob or screwing in something. You're supinating when you're doing that because your wrist is turning upside down, and then when your palm returns back to its on top position where you normally have it, that's pronation, which is your palm faces posteriorly or downward. And the last pair is dorsiflexion and plantar flexion. The easiest way to remember that, I generally like to think, is like walking, because everyone always walks everywhere. And dorsiflexion is when your toes are elevated. So your toes come forward And plantar flexion is your toes point downward. So that's like when you're propelling yourself forward. So you can see like in the picture, you're pointing downwards. And that's when you're pointing yourself. And that's plantar flexion. And dorsiflex up. And so this is probably the way I would explain it to patients. I probably would print out this picture and then try to explain it with the words the best I could. But ultimately, I think that these pictures would probably be a better representation of anything I could ever say or what the actual terms mean, because the words are a little confusing and they can be mixed up very easily. So I hope that this helps anyone out who might have been a little confused or might have needed something otherwise. Thank you, and I hope everyone has a good night.